Next, I would like to introduce Marta Segura, who is the city's Chief Heat Officer and the Director of Climate Emergency Mobilization, to welcome and get us started. Thank you.
Great. Good afternoon, everyone. Thank you so much for joining us today. It's really quite the moment in our history, and in Los Angeles, we continuously are having these heat waves this heat season, and I'm sure it's obvious to most of you why we're having this conversation. But I want to reiterate that extreme heat is our most dangerous climate hazard in Los Angeles and California. Heat waves are longer, more frequent, and I guess you've noticed that the nights don't necessarily cool off, and it's definitely worse for low-income families and people experiencing homelessness. All of those individuals in homes without air conditioning systems suffer the most, and the heat risk maps produced by UCLA have shown us that those areas are also correlated with pollution burden. So we also have community members who are overburdened by heat risk because they have pre-existing health conditions, whether it's asthma, COPD, diabetes, heart disease. Any and all of these pre-existing illnesses and diseases also make you much more vulnerable to extreme heat, which complicates the issue when these individuals show up at the clinic or the hospital or the emergency rooms, because the doctors might indicate that it's because of kidney failure or a heart stroke. But the reality is that heat has exacerbated their conditions because it also catalyzes the particulate matter and the air pollution in the air to increase the exposure to all individuals, but again, much more so to our vulnerable individuals in Los Angeles. So as heat records continue to exceed previous years in California and the nation, our hospitals are overburdened, our clinics, our caretakers, our city resources, our fire departments, our ambulances, our outdoor workers, and our infrastructure is vulnerable too. So all of these unanticipated expenses, costs are coming down on cities, and unfortunately, the federal government still does not recognize extreme heat as a disaster, but we're all working on that and seeing if and advocating for the Stafford Act to also cover extreme heat. So our campaign has launched. I know we're calling this the Heat Relief for LA campaign launch, but some of you might have noticed that our bus shelters have our new PSA campaign in 4 different languages. We've also, since early May, have been distributing our multilingual heat safety materials to community-based organizations, to other agencies, other city departments, council offices, and we've delivered them in person. We've also mailed them out. We also launched our social media campaign, and we'll be talking about all of these different facets and elements to our heat campaign and why they're important. Next slide, please. I also wanted to show you this heat map because it shows us that there are 31% more extreme heat days now, but by 2050, it'll be 31% more. And as of now, there are already almost 1,200 daily excess ER visits during extreme heat days. And this was before we broke records this year. So it could be even more. I hope not, when we get the numbers coming from 2020 and beyond. And UCLA School of Public Health is working on that for us. So we want to make sure that locally we have more accurate numbers, we have more recent numbers, and we're coordinating with the state, the county, and universities like UCLA to ensure that we get faster access to this data so we can make sure that the resources that are needed are going to where they're most necessary. Next slide, please. I also wanted to share with you all that we have just completed our heat action framework, which is going to lead us into our heat action planning. And within that, we have 5 different tracks. The first one is create a citywide extreme heat public awareness system and campaign. We've already started on that track, but we want to continue to expand upon it. And that's the one we'll be talking about today. But we're also going to strengthen our heat response and community resilience services. For example, our cooling centers, our hydration centers, our stations. In addition to that, the bus shelters and the shade structures and our emergency response services that go out and respond to those that are experiencing heat injury. And Track C is increasing heat resilience of the built environment. So how we accelerate the decarbonization of new buildings, existing buildings, our transportation systems, to ensure that not only are they not causing more greenhouse gas emissions to accelerate the warming, but they're also providing a place that's cooler using energy efficient and renewable energy technology that goes along with our LA 100 equity strategies that LADWP has already begun to plan. And Track D is how we improve and increase nature-based solutions. Our urban forest officer has a unified forest management plan that is targeting areas that lack tree canopy and shade equity. So we really want to ensure that in the future that we're not just planting lots of trees, but we're planting them strategically and we're maintaining them where they're most necessary. Same thing with our stormwater infrastructure. So there's lots of parts, there's lots of moving parts and lots of infrastructure projects that go along with nature-based solutions. And then Track E, to develop a citywide heat action accountability system so that we don't just have an amazing plan, but we're able to track and demonstrate where we're making progress and where we need to focus and where the gaps are. So that's going to be a really key part of our future heat action and resilience plan that we'll talk about at a future webinar. So now, next slide, please. This is just something, we'll share the slides with you, but we wanted to share with you that CEMO really believes in ensuring that we have distributional justice and that we integrate the voices of pollution-burdened communities and their needs and their perspectives to ensure that we create an equitable heat planning program, that it includes collaboration with these communities. It incorporates best practices, that we address heat health inequities across the city and across the region, and that we evaluate the effectiveness of those outreach strategies as we move forward with this heat outreach and investment. Next, please. And then, as I mentioned earlier, we already launched our Heat Relief for LA campaign. And I mentioned that we have PSAs on bus shelters. They were created by the iconic artist Lalo Alcaraz. We've distributed all of our multilingual heat safety materials to various CBOs, I think over 40 CBOs. We're also working with the LA Regional Climate Collaborative in distributing their social media messages and campaigns. Digitally, we have this information in 15 different languages. We have Visión y Compromiso working on a door-to-door and virtual and in-person events, as well as other organizations like PSRLA, who's with us today, and Rising Communities, who are with us today, who are doing some of this person-to-person, door-to-door event distribution of the materials. Also very important is our social media strategy and campaign. We share many of our materials on there, but also it gets activated when there's a heat alert, and we notify folks that there is a heat alert, and we give them tips on what to do, where to go, what city resources are available. We're very excited to have the cross-departmental council office and agency partnerships. And we're extremely proud to have so many community and organizational partnerships. And we thank the media as well for sharing this information. And we have broad earned media support on radio, print, online, TV, and podcast. And next is why we're here today. We wanted to talk to you about the community health educator model, or the promotora model. So this is what we're here to discuss today, and why this culturally relevant peer education model is so important to all of us. But before we go there, I want to switch over now and introduce you to our panelists or speakers. First, we have Dr. Michelle Burton. She's the Chief Executive Officer of Rising Communities. Michelle, would you like to introduce yourself? And then I'll introduce the rest of the panel.
Sure. Hi, everybody. Dr. Michelle Burton, CEO at Rising Communities, native Angelino, born and raised. Very proud of that, and just happy to be here to support this extremely noble effort on behalf of the city of Los Angeles. It's big, but it's big. And Marta, you've been a tremendous leader since you stepped in there, and I've seen you rolling around, passing out flyers and materials, and in the heat.
In the heat.
In
That's
the
right.
heat.
We can't avoid that.
Mhm.
Thank you, Dr. Burton. Next, I'll introduce Stephanie Campos, the Director of Strategic Planning and Special Projects with Homeless Healthcare LA.
Hi, good afternoon. Thank you so much for having me. I'm really excited to share the work that we're doing in the community in partnership with so many of you. And I'm also a local, so I wanted to share that.
Great. And next we have Tiffany Rivera, the Climate Health Project Coordinator for Physicians for Social Responsibility, Los Angeles. Tiffany.
Hi, everyone. Good afternoon. Thank you for joining us this afternoon. And thank you, Marta, for the opportunity to speak at this panel. I want to share the good work that we're doing with PSRLA and our academic and community partners.
Great. So this is a conversation amongst colleagues and really allies. And we thought it would be really important to show to Los Angeles that campaigns aren't just about advertisements or PSAs or even the media. They really have to be personal, and they really should be from peers, because we need these very close, trusted partner networks to convey information that really can be abstract and difficult to understand. Climate communications is a whole other area of conversation, but I think when we give this information to individuals that really know their neighborhood and their community, it makes a big difference. So that's what we're really here to sort of unfold and discuss with everyone today. So my first question is, why is it important, Dr. Burton, for Rising Communities to empower community health educators to build awareness about extreme heat? And why does this model work so well, in your opinion? I think you're on mute, Dr. Burton.
Unmute. There we go. Okay, you can hear me now?
Yes.
Yes, alrighty. So thank you, Marta, for that question. Climate change has compounded and further exacerbated a lot of the disparities that we're already aware of as they relate to the social determinants of health. And you pointed that out around chronic disease management and, how extreme heat is just, again, making these issues harder for us to cope with on an individual and community level. And so the City of LA's new, Climate Emergency Mobilization Office hinges on the deployment of these community health educators who are largely, people of color who are living in and serving high-risk communities of the city of Los Angeles. And at Rising Communities, we've partnered with the city to distribute information through our own community health educators, AKA community health workers, and leveraging our partnerships, such as the one we have with the LA Regional Collaborative, which I think you were referencing them earlier as well, along with UCLA Institute of Environment and Sustainability, the Department of Public Health, Environmental Justice and Climate Health Office, as well as the San Fernando Tataviam Band of Mission Indians, on a grant at the state level, because they're also looking at heat from their Office of Research and Planning. And through that, we are, leaving things with folks, right? People like stuff. So we're making sure we're allocating resources to things like magnets and water bottles and fans and cooling bandanas, things for kids hats, sunglasses, sunscreen, collapsible dog bowls, one of my favorite. Because we love our furries in Los Angeles.
Mm-hmm.
Umbrellas. I personally have been looking for a Riddler parasol because I think that would just be fabulous. So, doing our best to keep it fun as well and keep it light and educate people and give them resources. Also with our community health workers, lastly, I'll just say that, the fact that they're so critical to this effort means we have to treat them like gold, right? So we're making sure that they get proper training so that they themselves can stay safe and stay cool as they're delivering this much needed message to their neighbors and community members. And that they're also paid a livable wage by us, and encouraging that with our partners. For this particular initiative that we have, they get a $1,300 stipend just for participating. So I think incentivizing our community health educators because they're valuable, keeping them safe, and assuring that we're supporting our partners to do the same.
That's a really great point of respecting the time and the talent of our community members, and especially with issues so critical as saving lives, right? Because we often don't think of heat generally as the killer, but it has been the silent killer for too long. So Stephanie, I'm going to go to you next, because you have a different community, but you also have outreach workers, and you have climate stations, and you have the refresh spot. So tell us a little bit about how your awareness campaigns or educational efforts are geared towards having peers share that information.
Yeah, sure. So we have a few different models focused in the Skid Row community. So the Refresh Spot is a 24/7 hygiene center in partnership with the mayor's office and a dozen other partners that come on site and do added resources. So we've been super grateful to CEMO also, who has dropped off materials that we distribute to the community. In that setting, we're very fortunate to have an indoor space that is climate controlled. It's not a large space, but we make really great use of it during the summer months, of course. We also want to distribute supplies for the community, sun protection products, baseball caps, hats, reusable water bottles. We have a water box there so people can stay hydrated. And I love that Dr. Burton brought up about the furry friends. We are very pet friendly, of course. And so we are working on adding a pet drinking fountain also, but always have a pet pantry available for them. And also just like otter pops, which people really love and just helps bring down, if you're feeling warm, it really helps bring that down. And like neck towels that can keep you cool for a long time. We have 3 climate stations that are funded year-round now around Skid Row also, and that's in partnership with the mayor's office, Urban Alchemy, and a few other partners. And the wonderful thing is that those are also 24/7, and they provide water always. They have about 20,000 water servings every month at these locations, and also give out just so many sun protection products, and a place where people can sit and rest in the shade. They have misting fans. It provides immediate relief from the elements. And then they call them practitioners, the staff that work there. And it's a lot of staff, from the community, maybe formerly incarcerated, but it's just a really diverse workforce, which we also have at the Refresh Spot. So we're just excited about keeping these programs going and collaborations going as well. We have outreach teams at Homeless Healthcare that focus in different encampments and triage people at the street level. So they also are out there during these, summer months and always.
Amazing. Thank you. And so Tiffany, I'll go to you next. I know you have a lot to share about your health educator program.
Yes, thank you, Martha. So I've been working on the PLACE study. It's an academic and community research partnership. This is in partnership with USC, Dr. Jill Johnson at the Environmental Justice Research Lab, and Professor Bhavna Sharma-Sunder at Occidental College. And we've partnered with the LEAP LA Coalition, which is it's 5 community-based organizations: Pacoima Beautiful, Strategic Concepts in Organizing and Policy Education, SCOPE, Esperanza Community Housing, Sacred Places Institute for Indigenous People, and Communities for a Better Environment. So our approach has been a little bit different, where we've had a series of informal listening sessions that have really informed the curriculum we developed. And now that the heat season has arrived, we've been hosting workshops in various frontline communities in Wilmington, Pacoima, and South LA. And in these workshops, we teach residents about existing resources that are available through the city and CEMO, and also how to identify heat-related symptoms and how to respond to these symptoms. And we do this using a combination of like PowerPoint presentations as well as interactive activities. So one that folks really get into and learn a lot from is a Jeopardy game. I think it's nice to create a little bit of competition amongst community members. They really want to get the answers right, and it's a good way to have the information stick with them. We also have ground truth, used a mapping exercise to ground truth existing cooling spaces in their neighborhoods. So we created these large printout maps identifying cooling centers, parks, rec and park facilities, and asked participants to share if they were aware of this resource, any additional services that are offered there, or any other programming that would encourage folks to use this space. And so not only are we providing residents with useful information they can use to protect themselves during a heat wave, but we're also distributing physical resiliency kits, similar to my colleagues here who distribute materials that will help keep people cool, like sunscreen, sun hats, hydro flask, and things like that.
Amazing. That sounds fantastic, because I think what I find hard in the general population is to convince folks that summers aren't what they used to be. In fact, heat season now lasts from mid-June to almost mid-November. This year we got our strongest heat wave so far in June, but normally those came in September. So things are changing even in Los Angeles from year to year in a very drastic way. So I think the more we could talk to people about how different it is now and how much more it will continue to change, people will pay more attention to how they prepare themselves when they leave their house, or how they protect family and friends and really vulnerable communities that they're connected to. So I thought maybe we could give some examples of things that we share with community members, either as community health educators or in our webinars or in our training sessions, that can help people prepare for extreme heat. I'll come back to you, Dr. Burton.
Yeah, I think I wanted to share some of the feedback that we've gotten directly from our residents in some of our initiatives, because we have been surveying and doing some listening sessions. And so some of the things that I know my team wanted me to lift up was, folks asking for things like more shade at bus stops, which I think is a great point, because, oftentimes there are things we can do and things we can't do. And, this is one of those issues that can definitely be remedied. More apartment units or homes should have built-in AC units. I mean, that's the ideal, right? That's the ideal, and that's very difficult. That's going to take a lot of advocacy with, apartment building owners and landlords, and perhaps partnerships, or looking at subsidies in the future for this type of conversion. A lot of survey respondents felt like there was not enough tree coverage in their neighborhoods. Back to this idea of shade, right? That's also another one that is fixable. There aren't cool spaces or centers to spend time with their whole family. So oftentimes there might be spaces where you can go and sit, but it's not necessarily conducive to your kids running around and playing, right? So having more cooling spaces that are appropriate for the whole family. And then expanding access to at-home heat adaptation resources, like air conditioning and insulation retrofits. So, if they can't get a full built-in AC units, what are some of the, the other options or subsidies that could be provided for some of those more simple units that are installed, especially the ones that are both heat and air, because we know, unfortunately, it gets cold too. And that's an issue for, a lot of folks. Depending on what area of the county you're in, you may actually get a little snow. And if you don't have any heat, then that becomes an issue as well. So, just sort of, those were some of the most frequent points of feedback that we've been hearing from our community members thus far around how we might, do better. What we're currently doing is just partnering. We have our sustainability hubs across South LA. We've partnered with churches so that we are working with them on, they offer respite, to certain community members during different times of the day. We're also looking at how we might even convert our own office space. This is a challenge I've put to my team. We have it's not a large, but a small little office space on the second floor at Crenshaw and Adams. And, perhaps it's not appropriate for full families, but maybe we target seniors, maybe we target the disabled. So are there particular populations that different organizations or entities or facilities are willing to host? So really looking at, how do we set an example and model that? And then how do we reach out and find other partners to serve our community members at these times?
Yeah. So I think a key point, if I may, is that when we're working with peer health educators and the community, a really important place to start is asking them what they think the solutions are and what they think they need. And that's what Dr. Burton just shared with us, is her survey and the results of her survey. I do want to say that, the city of LA has senior centers, we have family source centers, we have, libraries, and some of those have community centers within them that can lend themselves more to having kids and having charging stations. And of course, all of them now have hydration stations. All of them obviously have restrooms, and they're all ADA. So I think part of our challenge at the city, if I may, is conveying to CBOs and community members that these facilities are yours. These are public facilities. They're definitely open during hours of operation. And what the city's trying to do is expand the hours of some of those with the support of the federal and state government to get the resources for overtime and that kind of thing. So since we're on the subject of feedback from the community, I'll go to Tiffany, because I know that she had some feedback too from the surveys that they've done and the focus groups that they've done.
Yeah, so I think the biggest takeaway that we've learned through the surveys that we distributed at CEMO's first ever in-person community assembly and feedback that we've gathered through our informal listening sessions is that people aren't aware of the resources that do exist. There are like utility assistance programs, home weatherization, and other upgrade programs, but people don't know how to access this information. So I think a great starting point would be to add capacity and assistance to helping residents apply to these programs. I think it would help remove one barrier and make these programs more accessible to the communities that need them most. And of course, we've heard that oftentimes these frontline communities don't have the amenities that they need to cool down. They're lacking green space or bus shelters. And even the amenities that do exist, they often become overcrowded. For one example was a pool near the Wilmington area. And they basically said if families don't get there by 8 a.m., they're not going to be able to find a spot under the shade for their families to spend the day in.
Wow.
So yeah, so just increasing the amount of spaces that these communities have access to, and then teaching them how to take actions within their own home to stay cool. Not a lot of homes have central AC. So teaching them DIY tricks of how they can make an AC at home by placing a bucket of ice in front of the fan. And teaching people what the threshold is at 95 degrees Fahrenheit. When the air temperature reaches that high, like fans are not an effective cooling method anymore. So if they are able to leave their home, they should visit a cooling center or park and rec center. So in our workshops, we have QR codes that link people to Cool Spots LA, the LA County Library Finder, and the resources that do exist. We're trying to close the gap between the resources that are available and people's knowledge of them.
That's amazing. You have no idea how happy that makes me. I'm just so like, yay, it's working. people are getting the information. And we're having our librarians, many of whom are not just multicultural, but multilingual, figure out a way to let us know if during a heat wave, there are more people using the libraries and other public systems so that we can, again, advocate for more funding and resources for those areas. And as you say, Tiffany, how do we improve our splash pads and our pools? It sounds like we need to provide more shade there as well, so that it's a more usable resource for our community. So thank you for that phenomenal feedback. Now I'll come to you, Stephanie, because you must hear things from your community as well, and from your outreach workers and other providers. We'd love to hear what you have to say.
Sure. So we did conduct a survey earlier this year to kind of look at how people are handling the climate, the weather, the heat, whether it's cold, focused on our guests at the refresh spot. The majority of folks, of course, were saying when it's hot, they get very stressed. They don't feel like they have protection from the elements. They'd have limited places to go. So it's helpful feedback to have, and also kind of like looking within Skid Row boundaries where it would make sense to add like more climate resilience resources. Maybe not, more separated from where the climate stations are and other resources. So that's something to look at also. And then just like we are just seeing more of an increase in just the populations and wanting to be indoors, which isn't, I guess, typical to previous years, but we're really, really focusing on putting it out there that they can come in and be indoors, be safe, ask for resources. We try to do our best to accommodate people. So that's something we've been really proactive about, that is more on the newer end.
Okay.
Yeah. So, and then in terms of like other sources, I know that like the refresh spot and like some of the other things I'm describing are fixed locations. So we know it can be a barrier for people to come and access those locations. So we do offer this area where people can leave their belongings. That way they can use the site, have peace of mind, and then collect them later. But always like having a mobile outreach or mobile services is something I always advocate for as well, because I don't think there's enough of that. So we can come to the folks and to the community.
Great. So as we're transitioning to Q&A, and you left us with this great idea of advocating for something. Dr. Burton, what would be one thing you would advocate for before we go transition to Q&A, and then I'll go to Tiffany?
Yeah, I was actually looking at the questions, and the one thing that I would agree on with Mike Browning is, at what point does access to home energy become a human right? Right? At the end of the day, it's just math. There's 11 million people in the county. If we expand it, we're never going to have enough room. If you take the square footage that's available, it does not match up. So we have to be able to serve people in place. So that's what I would advocate for, is that, we have to come up with a strategic plan that really addresses how to keep people cool and safe where they are. Especially when you have to recognize, many people can suffer a critical event trying to get to one of these places in the middle of this type of heat. So I do think at some point in time that has to become a real part of the conversation. I know many of us have been advocating for this type of access even during the pandemic. So, I think we need to continue to do that, collectively.
Great. There are a couple of council motions. We've responded to them at LAHD, and other departments will be responding to them. It's a conversation happening at the county, at the state. So I think we will definitely continue to do that. And then LADWP has this LA 100 equity strategies and the strategic long-term resource plan. And the reason that I mentioned them is because all of these conversations have to work in synchrony so that we can see the results and the outcomes that that the communities are advocating for. Tiffany, what would be something that you want to highlight before we go to Q&A?
I think number one would be making access to parks and green spaces equitable, and just increasing overall tree canopy in neighborhoods, but also increasing the capacity and the functionality of libraries and cooling centers. I think this could be an opportunity to distribute climate and health education resources in these spaces, and also to partner with like local artists to provide more programming there for families. Another thing we heard is that oftentimes families don't stay at libraries for very long because the kids are a bit bored and become antsy. And so just having more things for them to do would make this place more accessible for families.
Great. So thank you all. And we're not done yet. Don't go anywhere. I'm just going to give my team a few seconds to bring up some of those questions. And I think Christine Lee on my team was going to let us know which is the first question we're going to respond to. And maybe while she's doing that, I will say that the City of LA and the Department of Water and Power are working closely with community members within the context of these steering committees to give this kind of feedback. And another challenge for existing buildings and cooling is that if we just use our regular air conditioning systems, it's going to put a pressure on, the electrical systems and the energy systems and greenhouse gas emissions. And we'd like to see healthy homes for everyone, including the use of tools such as heat pumps that lower your energy burden, bring you thermal comfort, but at the same time, are more energy efficient. And along with obviously all the other retrofits that are needed to make our homes healthier. So it's like a comprehensive approach that the city needs to inspire, incentivize, consider. And the camera project at LADWP is collecting data and information on how much this costs so that we can then begin to project out how long it might take to convert all of these existing buildings so that they're all healthy, thermally comfortable places for people to live. So I see Christine Lee. Go right ahead, Christine. You have our first question.
Great. Thanks, Marta. Yeah, I do have our first question, but before we begin, I just want to acknowledge that we will most likely not be able to address all of the questions due to time constraints, but we will still be sharing our slides and resources after the event. So please reach out to us via email if you have any questions that we couldn't answer during the session.
Thank you.
Our first question, and I believe it might be for you, Marta. Where can council offices pick up these materials? It was from Stella Stahl. She wrote, they host monthly neighborhood support days across district for unhoused folks, and it would be great to provide other resources.
Amazing. Well, we have many of them, most of them in our office. So I suggest reaching out to Christine Lee and that email that we provide in our materials. We're at City Hall, so that's the good news. We're very close to City Hall and council offices anyway, so we welcome all council offices to come by to our office and pick up materials. And Christine and Rebecca will arrange that. And also, they're on our website so that you can peruse which ones you want and which languages you need before coming out, so you can sort of plan ahead on which materials you'd like to have for your district offices. Thanks for that question.
The next question is from Danielle. Do any of the campaigns address safety from wildfires and wildfire smoke?
That's a great question. Does anybody want to volunteer for that? Okay, Dr.
I mean, I
Burton.
can say that, we're working countywide on our initiative. So, depending on the community that our health workers are in, they may be talking about wildfire and wildfire smoke, right? Because that's an issue more of an issue in some parts, of areas than others. For the city of LA, I think it's still also an issue, but I will say I don't think we're standardizing. So I think it's a very good question and I appreciate it. I made a note about that because I want to ask, because I remember growing up in LA and, over the years, and there would be huge fires. And I don't know if you remember like coming out and there's ashes, right? Falling right here, city of LA. So it is real. It's not something I think we think about all the time. And I'm not sure we're standardizing, just making sure everybody has that information. So good question. And I know that we could do better with making sure everybody has more access to that knowledge, not just people living in the areas that sort of get hit every year, right? Every year they've got wildfires next to them.
Right. And I just read an excellent article. Thank you for sharing that, Dr. Burton, that discusses how extreme heat and drought create more wildfires. And then also our practices on how we maintain urban forests. If we don't have controlled burns, then we're going to continue to have more wildfires. But I also see the connection between like air pollution, smoke, particulate matter, and extreme heat. Remember, I talked about that connection earlier. When you have a heat alert or any level of heat, and you have particulate matter, which is smoke from wildfires, that increases, the amount of heat strokes and heat injuries. And so we want to figure out how FEMA, the Federal Emergency Management Agency, can both fund the response for wildfires, putting those out and recovery, but also the damage that the smoke creates, not just where the wildfire is, but in surrounding areas, because we get the smoke, even though we're external to most of those wildfires. Smoke travels thousands and thousands of miles, right? Next question, or does Stephanie or Tiffany want to respond to it? Okay, next question.
If I may add really
Yes.
quick,
Yes.
our curriculum doesn't cover wildfires specifically, but we do talk about cumulative health impacts in the context of air pollution and extreme heat, as you mentioned, Marta, like on days that both have high air pollution and are extremely hot, the incidences of emergency room visits increase. And to make it relevant to folks and to meet them in their reality, we talk about this in the context of being next to oil drilling sites or other polluting sources. So just cautioning folks to be extra careful on days with both poor air quality and extreme heat.
Oh, amazing. Thank you. Good point. Go ahead, Christine.
Great. So the next question is from Catherine. She wrote, "We see that there is an urgent need for heat resources and cooling centers for day laborers in the Van Nuys area. Are there enough cooling centers in Van Nuys?" And it's a multi-part question. And have you tried, or how are you planning to make sure that day laborers know what cooling centers are and know how to access them?
Great. That's an excellent question. I would love to meet with her and the NDLON, the National Day Labor Organizing Network, who we've worked with before, and figure out through our Cool Spots LA map and app, which cooling centers are closest to those day laborers in Van Nuys, and how we could coordinate and collaborate and leverage other resources to help NDLON and the day laborers. But I don't have a specific answer on the resources at the moment, but I'd love to work with you.
I just would also add that some of the organizations we're working with in that area, I know, are specifically communicating with day laborers.
Okay, great.
Yeah, and so yeah, I took a note there because I want to reach out and see specifically as well, if we're working with this particular group that's in Van Nuys. So
Yeah.
we'll take a look at that as well, because
Yeah, and that would be a city-county collaboration, because again, Van Nuys is city of LA, and you're with the county, and I'd love to coordinate and collaborate so we can have that response and approach. Great question.
The next question is from Nancy Zuniga. She wrote, "Hi, I'm curious of the CBOs mentioned, which ones are focused on sending health promoters with resources to where outdoor workers are in our city?"
Great. I'll start by saying that most of the people that we talk to are workers, and many of them are outdoor workers, but I don't know. I don't want to answer for the rest of the team. I will say that the city of LA does not have jurisdiction over worker health and safety. That's the jurisdiction of Cal OSHA, but we will be inviting the UCLA Labor Occupational Safety and Health Program to be on our community advisory board, so that they can provide us with more insight and more recommendations on ways the city can be more resourceful to provide information about, outdoor workers.
if that's the Nancy I know, hi Nancy, I'm going to send this question out to the team as well and see if there's any of the organizations we're working with specifically that are focusing in on outdoor workers. I do know that there have been some recent policies passed, and I think by OSHA, where it's like they have to be provided with a shaded area for lunch and things like that. I myself was really excited. Like the other day driving, it was new. It was like this little truck. It had tables, like little lunch tables in it and chairs, and they were in there just chilling.
Yeah.
In the shade, eating lunch. So I thought that's new. And so there's definitely some changes happening as well, which was good to see.
Mhm. And I'm going to get this wrong, but I know Climate Resolve and Enrique Huerta from Climate Resolve have been working on indoor air thresholds for extreme heat. And yes, good news is coming soon, and we will write about that in our newsletter and probably have a future webinar on it. But there are definitely already requirements, as Dr. Burton was saying, to provide more breaks, to provide more shade, to provide more hydration when there is a certain threshold that's met, either indoors or outdoors. Next.
Great. Another question from Kim Hughes. Have we looked at metro stations as a location for cooling that can be organized and provide resources?
I think Metro is looking at that, and they just created a navigation center in the 9th district that will specifically support the unhoused, where they can go for resources, water, bathrooms, and cool off. But I'll have to confess, I haven't had a conversation with Metro to coordinate that conversation. Maybe Dr. Burton's county-wide effort that she gave, maybe they have had that conversation. We do have a campaign with Metro. We have the bus shelters, and then the the messaging that's inside and outside the buses with the LA Regional Climate Collaborative. But I think the next step is definitely talking to Metro about what resources they have for cooling.
Yeah, honestly, I mean, Metro, I don't think has ever even come up in any of the conversations or discussions we've been having as of late. So again, I marked this one down. This is great, so I'm going to reach out and say, hey, is anybody talking to Metro? Are we working with Metro? We've certainly been working with them in terms of keeping, as usual, they reach out and they want folks to help keep these areas nice and tidy and clean and all of that good stuff. But we haven't been, they haven't been reaching out to us. I can say that, right? We're not hearing from Metro about anything. So I do think it would be great if we reach out to them. So I like the prompt.
Yeah. And it's good to think about a regional approach and all the agencies within the region and beyond that can be the connective social fabric, because residents don't see the difference between Metro, City of LA, County of LA. For them, we're all their government. And so I do think we should strive to be seamless and resourceful and make it really easy for community members to walk into wherever, whether it's Metro, County, City, and then be a resource to them. So thank you so much for that question. It's a phenomenal question.
Yeah, and I think this is also a great follow-up question. How are we ensuring that cooling centers are accessible to immigrant and documented communities with limited access to social media?
We funded some door-to-door this year, and we distributed the materials to 40 organizations or more in frontline communities and low-income communities, many of them serving the monolingual or those that speak very little English. That's why we have our materials in 15 different languages. But between what we're doing and what the county is doing, and that's why we're talking about promotora models, and I'm glad that you brought that up, because promotoras speak the language of their communities, are culturally relevant health educators, and Tiffany's program at PSRLA is a really good example of how they're making these resources available. So I'll volley it back to Tiffany. So maybe you can reiterate that answer that you gave us earlier, and then we'll pass it to Stephanie and then Michelle.
Yeah, thank you, Marta. I think this is when community-based organizations come into the picture. Marta personally dropped off the CEMO heat materials, and we've been distributing that at our workshops. So that having that trusted community partner, a familiar face that residents are already familiar with, sharing this information can make it more accessible to them, and then word of mouth from there, a snowball effect. You speak to one resident, they speak to their neighbor, and really painting the idea that we should be forming community where we live, so that we are checking up on the people who live alone or maybe don't speak English is not their primary language, they're not as mobile, and creating that social network.
Amazing. Stephanie, I'm curious, do you find many monolingual folks in the in-house community?
We do. Having the CEMO materials in multiple languages has been helpful as well. We have them posted and we also distribute them at our sites. And just specific to Skid Row, we have seen a very visible and uptick in monolingual Spanish-speaking immigrant families over the last maybe year, a little over a year now. So it's a regular thing now to see families, to see children coming into the refresh spot being in Skid Row, where maybe a year and a half ago that was pretty rare. And so we have no barriers for entry at the refresh spot, and neither do the climate station. So anyone, regardless of where anything, they can come right in and have access to these life-saving resources. So that's really important that we continue to do work like that.
Right. Thank you so much. That's really important. Dr. Burton, would you like to comment on the Trusted Partner Network? Yeah.
You know, and again, it's the whole point of this panel, right? What the importance of our community health educators and workers and promotores. And it's meeting people where they're at and serving the least of us. And to me, that's always undocumented, monolingual, indigenous, queer, homeless, transitional age youth, like differently abled. You know, these are the hardest to serve, justice involved, right? Hardest to serve populations, you know, that we can get to. And I'm going to be perfectly honest, we can do better. All of us can do better. And thank you, Stephanie, for pointing out no barrier to entry. That doesn't happen in very many places. There's so many barriers to entry for all of these populations that we're talking about. And especially when you talk about undocumented and monolingual, they're still worried about public charge. We still can't get enough information out to people about public charge and, you know, what the realities of it are and are not. And so, and we're also in a very highly charged political climate where people who are undocumented and monolingual are even more afraid to put themselves out there to get information. And then if they get the information, getting them to access, you know, those resources, right? So I do think that we all have to become a bit more hypervigilant with how we are working with our community health workers to contact and work with and sometimes handhold these populations so that we can help keep them safe.
That's amazing. That's a really great statement. And for the person who asked the question or anybody out there, we have a wonderful list of organizations that are distributing these materials in multiple languages in some of the most vulnerable communities in Los Angeles. And I also want to point out that many of our libraries have multilingual librarians. So as we're showing folks that, you know, that they can walk into these public facilities, we should also let them know that many of them have multilingual librarians. Like if you're, the one in Koreatown has more folks that speak Spanish and Korean. The one in Chinatown has more folks that speak Chinese and other languages that are now prevalent in Chinatown. So I think the libraries have done a really good job of trying to have culturally relevant, culturally linguistic workers. And that's why our Trusted Partner Network is so valuable, because you do that naturally, you do that organically. And I just so proud of the work that you all are doing. So great question. Do we have time for one more question, or should we?
We do. We have
Okay.
one great question, and I think this will be a wonderful way to wrap this session today. If everybody could share the top 3 facts or observations you would like us to share with community members. The person who asked the question is a health educator and would like to have some talking points that she can share with community members during this summer.
Great. Well, I'll start by saying that there's some really great curriculum out there that we can also share when we send out the materials to all of our participants. But I'll start again with Tiffany, and then I'll work my way to Dr. Burton. 1 to 3 facts that you want to share for this question.
Okay. The one I will share and the one I think your poster does a great job of, I've seen it at the bus stop, is the main difference between heat exhaustion and heat stroke. Heat exhaustion is a serious heat illness, but heat stroke is a medical emergency. And through our workshops, we really want to teach people how to identify when they're in a medical emergency and need to call 911, either for themselves or for someone else. And I think the biggest indicator of that is that even though your body feels hot, you actually stop sweating. And if you had access to a thermometer, you would have a temperature over 103 degrees. But if you do not have access to any like medical equipment, you should just check the person's pulse. And if they have a strong and rapid pulse, that means that they're experiencing heat stroke and should call 911.
Wow, you sound like a medical doctor. Thank you, Tiffany. That's awesome. All right, just one, Stephanie. What's one thing that you'd like to share?
Thank you, Tiffany. That is perfect. People should be aware the materials should go out there in the languages. People can call 311 for help, and like just hand out water bottles if you have them in your car to give out to our unhoused neighbors.
Thank you. That's awesome. Yeah, 311 has lots of heat safety information, the Cool Spots LA map, the county map. So yeah, 311 is a great resource. Great tip. Dr. Burton.
Sorry about that. You know, I hate to say it, but the first thing that always comes to my mind is don't wait to get help. You know, encourage people, you know, if you think you're, you know, with somebody who's experiencing a crisis or in a situation where they're going to be in a crisis, don't wait to ask for help, you know,
Yeah.
and ideally we don't want people going to emergency rooms in an ideal world, but if that's where you need to go, go. You know, just go. Or if you need to, go ahead and call 911. You know,
Yeah.
if you have moved beyond the level of needing information and you're in a critical event or you think somebody's in a critical event, just call. You know, and I think sometimes that's the hesitancy about accessing resources is, you know, these are the main ones. And even though they're overburdened to some degree, it should not keep you from asking for help. I can't tell you the number of times that I'm in meetings where we're hearing statistics of, you know, people dying because because they waited or they were afraid to, you know, burden an overburdened system. The system's not going to change if it doesn't continue to be overburdened. Let's be clear about that, right? So, you know, every time you call, every time you go in for help or services, that lets the fire department, the emergency rooms, those of us sitting in our little offices and doing this work, know, hey, people are in crisis.
Right.
We need to respond. We want FEMA to say that heat is a federal, you know, disaster. Let's get some numbers.
Let's get some
you know,
numbers.
Call
Yeah.
that 911, go into the emergency room, overburden the system because that's the trigger. And I want to be clear about that. So, you know, absolutely don't wait.
Thank you. This has been amazing. And as Dr. Burton pointed out earlier, today we talked about public awareness of heat safety risks and dangers, but the city and the county and indeed the state are all working on systems change. And as you know, we're talking about here, we need to let them know that we recognize that the systems change needs to come faster, needs to be accelerated, needs to go for first and foremost where we don't have these resources at all, where we don't have tree canopy, where we don't have enough AC in our homes, where we have pollution burden, because we at the city believe in equitable climate change and that we're accelerating climate solutions when we accelerate resources to the areas that need them most. So I want to really thank all of our speakers, Dr. Burton, Stephanie Campos, Tiffany Rivera, and everybody else that they represent and that they mentioned in their coalitions, and the audience as well, for being interested in this issue, for making yourselves aware of what you can do. CEMO is a resource, but so are all of these amazing organizations. And I want to thank my team and my staff, Amy Clark, Rebecca Guerra, Christine Lee, Gordon Haynes. All of them worked really hard to make this event very smooth and seamless. So I appreciate all of you and all the effort that you put into making sure that this information gets out there and that we make extreme heat a priority disaster and let FEMA know that they need to help us all out so we can provide those resources and be here for you. Thank you so much, everyone. Thank you for being with us today. We know you have other things to do, so appreciate you.